Yes, so today I'm here with Dr. Vaikuntaraju from Bangalore. He's a pediatric neurologist, and we're going to touch up upon a few points that will help parents understand what exactly the evaluation process is for ADHD and how to exactly go about treating these situations. So, today, Doctor is here to help me out with this. So, thank you so much for coming
Thank
here,
you.
Doctor. Good afternoon. Thank you so much for joining me today. Doctor, I have a few questions with regards to ADHD. Now, first, I would like to get started on what exactly ADHD is and how someone can look out for these symptoms when it comes to their child.
Yeah.
So, could you tell me a little
Yeah.
bit about that?
ADHD means attention deficit hyperactivity disorder. It is a most commonest problem you will see in children. Approximately 8 to 10% of children can be having these symptoms, and the problems is difficult in recognizing. Most of the patients, the parents think that it can be normal, some of them, but some of them face a lot of problems. So initially, it may be more common in boys compared to girls. So parents, they think they are very hyperactive. That can be normal for their age, but they'll face a problem when they join to the schools. When parents get feedback from the teacher that the child is not able to concentrate on studies, not able to complete their activities, then they will recognize that it can mean some problem, difficult in learning problems they can face. That time they will come to recognize this thing. ADHD means it can be difficult to recognize. It can be there sometimes in the home environment. That may be normal, but if it is there in multiple places, if it is there in the school environment, or if it is there in the new places, if child is always hyperactive, not able to sit and not able to concentrate, then you should think that it is not a simple hyperactive child, but maybe child has some underlying psychological or organic problem. Then you need to evaluate these children.
Another question I had is you said it was more common in boys than in girls. So, how exactly does it present differently when it comes to boys and girls? What is the difference between that?
Difference is in general, boys at the age of toddler age group, they are more hyperactive, maybe some probably because of hormonal changes. In general, also physiologically, also they are more hyperactive. But the studies also shown that the boys' hyperactivity is more. They will think parents also, even doctors think that boys will be more hyperactive, maybe physiological compared to girls. So if you are thinking of hyperactivity in girls, you need to worry about more about other secondary causes like underlying neurological secondary cause you should consider. If it is there in the boys, maybe you can evaluate like a regular child. If it is there in the girls, you should be more careful before labeling a simple thing.
Okay, understood. And what I wanted to understand is how does the evaluation process work from a neurological perspective?
Yeah. So once if we are considering the ADHD, so you need to evaluate first whether the child fits into criteria. There is some criteria, some questions are there. Based on that, you will diagnose ADHD. Given by American Academy of Pediatrics, many international guidelines, DSM-4 5 criteria will tell. So if child fits into that criteria of ADHD, so there are some criteria that can be evaluated by teacher, parents, and caregivers also, and doctors also. If it fits into ADHD criteria, then evaluation comes. So there are various causes for ADHD. It can be primary. Primary means me not having any specific cause. And secondary causes. Secondary, there are various neurological causes and also not neurological. Other systemic causes can produce this ADHD. Some of the examples are simple like nutritional things. Like iron deficiency is very common in Indian setup because lack of
Okay.
nutrition. So the iron deficiency initially they will present very hyperactive. So simple correction of iron deficiency by looking at the child by taking diet history you can recognize that they will poor in iron source, and by looking the examination like they will be severe pallor. Some signs are very helpful to diagnose iron deficiency. Anyway, they will be having other feature like pica. They are eating inedible things, that is more habit.
Okay, so what about other types of nutritional deficiencies apart from iron? Is
Yeah,
there a relation with omega 3s? Because I've
yeah,
heard a lot of research
yeah.
about that.
So many nutrition, not only because these nutrition, many vitamins, not only iron, the other vitamins like zinc, manganese, and sometimes vitamins B12 and other omega also. If there is a deficiency, these minerals and vitamins are essential for many enzymatic reaction in the brain, that is to synthesize the neurotransmitters. If there is any deficiency of these vitamins, they can have these ADHD, attention and concentration problems can have.
Okay, got it. Understood. What about other causes like
Yeah, other causes
metabolic?
is in nutritional. Other causes, most common causes may be in a birth-related injuries. So
Okay.
those born very early, the premature babies, they're more prone for ADHD compared to those born at the normal per age, like term babies, maybe immature development of the brain cortex,
Okay.
and that is one of the reason. And minor injuries to the brain, like at the time of birth, most common cause is lack of oxygen. Still, many of the deliveries happening in Indian setup at home without proper facilities. They can be lack of oxygen, not treating proper oxygen problem at the time of
The
birth.
brain.
So, if there is lack of oxygen at the time of birth, there may be some cell deaths in the brain that can cause hyperactivity symptom. Not only the exactly cerebral palsy is the most common thing you will see, but minor injuries can present like this hyperactivity. And other factors in the later immediately after the birth, lack of glucose, that is also very common. Feeding problems are known in children, small babies, so difficulty in adjusting the life from the womb to later on. So they can have a lack of feeding and oxygen and glucose from, they can also cause this ADHD problem.
Okay. So, what about comorbidities? What are the other symptoms to look out for? Are there sleep issues or gut issues?
So in addition to these causes, some other metabolic condition can cause ADHD. Like many of the metabolic condition, as I told, their vitamins are plays an important. There is a deficiency in the body. Like for example, one of the common example, homocystinuria, what you will call. When there is a defect in any
Sorry, what is
metabolic
it called exactly?
homocystinuria,
Okay.
that is one of the example, or PK. There are many metabolic condition where these enzymes are deficient. So when there is an enzyme deficiency, then the outer, the final out neurotransmitter, like the definite requirement of the cells will not be produced. So any underlying metabolic problem causing these enzymes and neurotransmitter not formed, they can have ADHD. Most
Okay.
common is homocystinuria and PKU. There is some of the metabolic condition, hyperammonemia. They can present ADHD symptoms or any underlying brain issues. Most common in epilepsy. So epilepsy, I'll be telling comorbidity, but epilepsy and ADHD can coexist because the same etiology can produce both ADHD and epilepsy also. So
Okay.
any other underlying brain damage because of any brain infection, brain injuries, or it can be because of brain fevers or rototropic accidents, any injury to the brain. In addition to other neurological problems, they can have ADHD features also.
So, when a child comes in and
Mm.
presents with
Mm.
certain symptoms of
Yeah.
ADHD and the parent
Mm.
comes in
Yeah.
concerned,
Mm.
what exactly is your process for evaluation? How do you figure out
Yeah.
where it comes from?
Yeah. So when child comes with ADHD, you should any other case, like you should go in details regarding the birth history. Anything happen, significant problem the mothers when baby is carrying, and at the time of birth, very important. As I told, the baby born at preterm or term, or immediately after birth, any admissions, any lack of oxygen, any nutritional like glucose, lack of oxygen, any injuries, and immediately after birth they can prone for infections also. Any infection, brain fever, sepsis, what we'll call. If all these histories, they are risk factors for ADHD. And later also any injuries to the brain, accidents or brain infections. These things should be taken into consideration, and after this thing you should evaluate for any other associated comorbidities. If only
Like an
ADHD is,
MRI or an, would you
no,
do?
after that it will come. But
Okay, after that.
clinically, so if ADHD is there, you should evaluate for other comorbid conditions as told. If there is some child, for example, only ADHD is there, whether other associated neurological problems. If child is a global development delay, child will be in delay in milestones in all motors, all milestones. In ADHD child, like primary ADHD, what you will call, they will attain walking and running very fast. But if it is a global delay, there will be delay in milestones like walking, sitting, speaking. Everything will be delayed.
What is global delay exactly?
Global means there are 4 dimension developments. Like some of them, walking you will call motor development. What you will call, they'll walking, running, and other is fine motor. What you will call activities, daily living, dressing, eating, writing, all those things, and communication, speech, and cognition. These are 4 domains. If all domains is decrease, you will call global delay. So when there is a global delay, they can also ADHD. So those children with global delay or delay in other milestones, you should evaluate in detail for underlying neurological problems.
So these are all
Yeah,
neurodevelopmental issues
yeah.
that come in. Okay, understood. So when do you then go about the process of then testing for an MRI or other comorbidities?
Yeah, so after taking history in the examination, you should look for various factors that give some important clue for the diagnosis. Like you should examine the child in detail, like head size. Child is underlying problem, head size can be less, and if it is head size large, also like accumulation of water or some substance in the brain, they can have underlying metabolic condition or leukodystrophy, what you will call. That gives important clue for various causes for etiology. Some of the other examination, any defect in the limb, one limb is not functioning, one leg is not functioning, any problem in the eyes, because refractive errors, that is not able to see properly child, they can not able to concentrate school, they will be having ADHD. And hearing also similarly, not able to hear the child properly, they can go for ADHD. So we should evaluate properly other
basic vision, sound test and all these things,
and whether baby is able to cope or not. And you should look for whether baby's IQ also is normal for age or not. If not able to understand child, they can go for hyperactivity. Examination, you should examine in detail the any weakness is there one side of the body, or any reflex or exaggerate, and any imbalance gait is there, that gives important clue for various underlying secondary causes for ADHD. So after examination, I have some tests. Not all children require tests for investigation, but after exam, if you think the child requires testing, so you can order simple test, like sometimes, as I told, hemoglobin, anemia, that is iron deficiency or beta deficiency. They can have ADHD, so you can order for hemoglobin test, iron test, and sometimes thyroid function can cause ADHD. Okay. So thyroid test can be done.
So it's been known to like have a link, is it, like thyroid and ADHD as well? What other links are there? Because I've seen some stuff about maybe sleep issues as well as even gut issues and things like that. Is that also something that's linked?
Those children with ADHD, they are less sleep usually compared to normal children. They will sleep less duration, and they may be difficult in falling to sleep also. So that is also one of the factors, and various other nutrition, as we have discussed, that can cause these ADHD symptoms, and this is the most common problems you will face. And other metabolic condition, as I told, they can have ADHD, but there will be clinical exams will give some important clue, but you cannot test all children with all tests. If it is some child is not gaining weight properly, then you should think of metabolic condition. And regarding the other tests, the scan can be indicated like a CT scan, MRI. Nowadays, MRI is preferred. If head size is large, head size is small, or any other deficits are there, then you should go for imaging. And EEG is one test that can be considered. If any child with ADHD suffering from epilepsy, they require ADHD with epilepsy, they require EEG testing should be done. That will detect what is a cause for ADHD and also cause for epilepsy. Because these children management is entirely different compared to ADHD alone. Some of the medication should not be used with epilepsy and ADHD. And other genetic tests, if it is a secondary cause of ADHD, is thinking nowadays genetic tests are easily and widely available and cheaper also. So you can consider these genetic tests also in addition to routine scans, blood test.
Got it. So once you've determined all of this and you've done the evaluation tests, how exactly do you go about treating it? And once you find out where the cause is from, for example, if it's a nutrition deficiency, then I'm assuming that you can maybe add some nutritional value and try and maybe control the symptoms or manage the symptoms. But when it comes to the other causes, how do you go about treating it?
So ADHD, so basic as irreversible causes, what we were discussed, that should be recognized and identified and should be treated. And if it is all recognized, still the baby is ADHD more than 6 months duration, that depends on age factor also. If the child is preschool, elementary school, older children. So preschool children usually will advise the behavioral therapy is the main thing that you should concentrate, because drugs should not be used in the early age group. So behavioral therapy should be given to the parents and also in the school and also in the environment. You should give some idea how to manage these ADHD children. In the elementary school, like after 5-6 years, in addition to behavioral therapy, you can have various drugs are available, like you will classify stimulants and non-stimulants. These drugs they are approved by
US
FDA.
FDA.
So those drugs can be considered after ruling out any side effects or secondary causal like epilepsy. These drugs, various subcategories of drugs are they are very useful, and there is especially the ADHD symptoms are severe, causing studies problem like moderate to severe one. If there is a failure of behavioral therapy, these drugs can be given based on child's adjustment. They be the drugs effect will be there for a few hours only. During before going to school, you can give the medication. The effect lasts for 5-6 hours. There are various other formulation like long-standing medicines also can be there. If child requires longer duration like 8 hours, 10 hours, the sustained release medications are also there that can also be given.
Okay, understood. So you said something earlier. You said reversible,
Yeah.
and I want to understand what exactly would you mean by reversible in this
Reversible
situation?
like underlying cause I told iron deficiency anemia is one of the things.
Mm.
If you correct the iron deficiency, they may not require any other treatment like behavioral therapy.
Okay.
Maybe initially few weeks or months after correcting the iron deficiency, we can have a normal result. Similarly, various metabolic conditions like homocystinuria, many other metabolic conditions, they have specific treatments are available. So if you correct those specific causes, so no need to have other ADHD medication, long-term medication are not required.
Understood. Would you say there's a lack of like awareness, and would you say there's a lack of like thought process when it comes to testing children for these type of things?
Yeah, that is very common because most of the parents think that ADHD may be common. Some children it is common, and they will outgrow. So unless parents, teachers tell that child has difficulty in learning, then only they will come to know. So awareness is important. If we improve these symptoms, child may better do in the school what exactly they are doing currently. So they should understand that also.
Absolutely. I think that's a very important message. Apart from this, would you like to share any message out there for parents who are watching this and they're trying to understand what exactly there should be, the process when they go about evaluating their child? What would you like to share
Yeah.
regarding that?
So when ADHD symptom, whenever parents feel that there is an issue with the child, definitely they need to consult a proper physician, maybe psychologist, psychiatrist, or pediatrician, neurologist. So evaluation is very important. So once evaluation is done, so there are various treatments as we discussed. Evaluation also there. They need to follow those rules, and also they need to practice same thing in the home that. They should improve their children's outcome compared to those without treatment. So if you give proper treatment, they may have better in learning later also.
Okay. Of course, I think that's a very important message. So thank you, doctor. Thank you so much for sharing these very insightful points. I think out there for parents, it would have been extremely helpful. And yes, thank you so much.
Thank you.